Welcome back to News 46. Lower back pain. Millions of Americans live with it every day. A variety of treatments are used to treat back pain, including medication, massage, manipulation, and physical therapy. There are also therapies that include a mind-body component. A new study examined whether two approaches that focus on the mind rather directly on the body could help improve long-standing back pain.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
One of the most important new understandings of chronic pain and chronic low back pain is that the mind plays a very important part.
Dr. Daniel Churkin from Group Health Research Institute in Seattle and co-authors studied two mind-body therapies. One is already shown to be effective for treating depression and other chronic conditions.
Cognitive behavioral therapy, or CBT, is a therapy that tries to address what are the behaviors that we do because of pain, and what are the behaviors that might actually help to alleviate pain versus help to actually create or keep pain going. How do I gradually get back to those activities that I've given up because of pain?
The other, mindfulness-based stress reduction, has not been well studied.
So you're bringing an atmosphere of friendliness and kindness to observing your experience just as it is. One of the things that I think mindfulness empowers people to recognize is that everything's always in a state of change. Breathing in, I'm aware I'm feeling this sensation. It's uncomfortable. Breathing out, I meet myself with compassion, friendliness, openness.
342 patients between 20 and 70 years old with back pain that had lasted for at least 3 months participated in 8 weekly 2-hour sessions of either mindfulness or cognitive therapy. A third group received usual care. Outcomes were assessed at 6 months and 1 year.
Cognitive behavioral therapy and mindfulness-based stress reduction led to an increased likelihood of having clinically meaningful improvement in back pain than those who were only receiving usual care. Benefits in decreased pain and improved function lasted for a full year, which is not common amongst most treatments for chronic pain.
It's something that can add to their toolbox for things that they do in different various times.
I think it empowers people with the skills to make choices and changes that enhance their well-being, reduce their pain, and increase their function.
Catherine Dolph, The JAMA Report.
These mind-body interventions can also be used in addition to traditional therapies. The FBI has unlocked Farouk's iPhone 5C involved in the San Bernardino shooting using an alternative method that didn't involve Apple. Given this new development, the Department of Justice is dropping the case against Apple. The government has been evasive about using this alternative method, but it looks like it worked. The FBI filed the suit ordering Apple to unlock the terrorist phone, stating that it was a matter of homeland security. The Holiday Task Force and the Prompt Disability Outreach Program hosted an Easter community picnic Saturday at Ian Deutsch Memorial Park.
We're here at Ian Deutsch Memorial Park, and we're celebrating our annual Easter community picnic.
Yeah, we will be. We're planning on serving 2,500 free meals today: hot dogs, hamburgers, ice cream sandwiches, 10,000 eggs. Just really celebrating families and bringing fun to the community.
This is all come together to make a day that families can actually just turn off their phones, not watch TV, come to the park and enjoy each other.
That's right. We have different organizations come out with their information on what's available for kids, and we're handing out Easter eggs. It's a very different kind of hunt than we had in the past, and thanks to Pete Up, who's coordinating that side of it.
You guys have a bear and an Easter bunny here.
The bear, nobody understands the bear. He just shows up and people love him, and the Easter bunny should be a given.
And so, is this all volunteers that are working here today?
Yes, everybody here is a volunteer.
And so, you do the Thanksgiving, the Christmas, and the Easter dinners. How can people get involved?
They can call the coalition at 775-727-9970. And extension 236, and just say, I want to volunteer for the Holiday Task Force.
Can anyone donate?
anyone can donate, and any donation will go directly through United Communities Coalition, and in the memo it would say Holiday Task Force.
Well, we're here today helping with the Easter picnic. It's kind of our one opportunity to participate in this event. We have the turtle train, which is now the pumpkin train out here. We're doing kettle corn and cotton candy. And of course, we're handling the Easter egg scramble for the community.
What's a scramble?
So instead of having the eggs hidden out, we've got them at all the vendors. And then we have our staff volunteers going around and handing them out to children as well.
And then a PDOP, can you tell everybody what that is?
Sure, we're a nonprofit organization here in Pahrump, and we are a social network for parents and children with disabilities. We provide resources here in the community. We're the only nonprofit organization in Pahrump that offers those services, and we're available to anyone who needs any help.
What's coming up next for you guys?
Next is Pumpkin Days in October of this year, and as usual, we're hoping to go bigger and better. So we're working already on the attractions and the plans for this year.
How can people get involved in PDOP if they need to use your services?
They can go to our website at www.pdop.info, or they can call us at 702-516-0847.
More local news after the break.